I am here today to talk about an amazing experience that I got to have visiting the Oprah Winfrey Show, which is the first show she did in front of a live studio audience in, I believe it was about 15 years. And so I felt so special to be a part of it. I can't wait to tell you the details and just give you my reaction from being a part of the audience on that day. I'm Dr. Lynn Nieman. I am a board-certified anesthesiologist and aesthetic medical provider in Northern Virginia at my business called Blossom Medical. I love treating my patients here and I love educating you on YouTube, so thanks for spending this time with me. If you find this content helpful, give me a little like below, but let's get into it. I mean, it was an honor to be in the audience. I was invited to go by my producer, friend, and patient, Elizabeth Skrzynski, and she graciously spoke my name into a room, and I got invited to go along with her to be a part of a really important discussion about shame, blame, and the weight loss game. Anyone who knows Oprah's history knows that she personally has a story in her life that just has so many just ups and downs, literally, about her weight and how she has been addressed by the media and by people who felt the need and also felt the permission to comment publicly on her weight as though that somehow equaled her worth in some manner. And obviously, she has a success beyond words, and we all know her by her first name and can appreciate what a master she is at the job that she does. There is nobody who knows how to command a conversation and interview in a more loving, gracious, and educated way. And it was a school just to sit in the audience of her show and watch her interview people with compassion, with grace, but also just being a force. She is educated. She is so smart. She is just 100% focused and concentrated in those interviews, and you can feel her energy and you can feel her passion for sharing information with people. It was an amazing life experience, and I'm so glad that I got to go. But there are some takeaways that I really wanted to, if you haven't watched the special, please watch it. If you did watch the special, I wanted to touch on a couple of things that really resonated for me as an audience member and are things that I hope the greater audience really takes away. In my career in medicine, I've taken care of people of all walks of life, and I've seen firsthand some of the other medical things that can go along with my patients who struggle with their weight and some of the other medical comorbidities that can be a part of their weight and also a part of their weight loss journey. And so it was so great to hear some of these stories and to actually have this conversation out loud and to have this conversation posed in a really positive and educational light. One of the things that I want to start with, which was, I think, an aha moment that Oprah recognized in the show. And even as someone who's been through medical school, been through residency, I've been in a hospital setting taking care of patients and in my own clinic, graduated from medical school in 2001. So I'm not a newbie to the medical profession. I've been in it for decades. Obesity is a disease. It is classified, it is recognized as a disease. I really feel, and even when I'm talking to medical colleagues sometimes, and even when I'm talking to friends, family, I really feel like the conversation around obesity still seems to hint upon the fact that it's somehow a moral failure on someone's part, to be honest, whether someone isn't exercising enough, whether they're maybe not eating properly, and if they would just choose to eat better foods, choose to feel better about themselves, choose to go to the gym more frequently, there is something that you can internally do in order to change your set weight point. And what we're learning through our medical research and what we're learning about people is that we truly do have a set point that our bodies really work towards maintaining that homeostasis or maintaining that weight set point. And it is really difficult for a person to have willpower to overcome the place where their body naturally wants to be by that set point And it actually takes us as medical professionals to recognize that this is actually something we need to identify and medically treat. And it has to stop that we are shaming people into believing that there is some other thing they could dig down deep enough and find the grit and willpower to overcome. We don't ask people with other medical comorbidities or other medical diseases to overcome with willpower. We don't ask people with heart disease or with cancer or with diabetes to overcome that with willpower. We don't judge anybody else with any other disease and think that there is something that they can personally do to overcome the medical problem that they're facing. So we really, I think, as a society, as people, and in the medical profession, we need to do a better job understanding the underlying disease process that is obesity and addressing that with grace, with compassion, and with understanding so that we are not putting an undue judgment or burden or shame on patients who are really struggling to feel the best about themselves and to be as healthy as possible. So if there is one take-home message, I hope that is the one that everyone in the audience heard and something that really resonates with you, or even if you are struggling yourself, to really maybe get to a place where you are compassionate with yourself so that you are less judgmental of yourself, thinking you have a deficit that you can't seem to overcome. This is a medical condition, and we should be able to reach out to our medical community for help. That is number one takeaway. And that just really struck a chord with me. And I know it struck a chord with other members of the audience and certainly with Oprah herself. The other thing that I learned, and again, medical professional, went to medical school, studied, board certified, have practiced in the medical field for a number of years. And this was absolutely news to me. Our gut makes a hormone called GLP-1. And we've found that in patients who struggle with obesity, the amount of GLP-1 that their body makes is actually lower. We know, or we've learned from our studies of semaglutide and tirzepatide, that that GLP-1 actually helps to reduce the hunger that we feel. It helps us feel full. And those things go along with just knowing when we've had enough food. When that GLP-1 is too low, we are not getting the right signals to our brain that we are full and do not need to continue to eat. I liken this to diabetes and insulin. When people don't have enough native insulin, we as a medical community have decided the smart thing to do so that your body can work appropriately is to replace that hormone. We're replacing insulin so that your body can work and you can maintain that blood sugar status appropriately so that all of your other body functions are working the way that they should be and we can maintain your best health. Like that with diabetes, or like that with obesity. If you are not making enough GLP-1, and we can replace that exogenously under the care of a medical professional so that you actually have that hormone that is giving your body the right signals and helping your body do the healthy things it needs to do and help you maintain a proper weight. That is not a judgment. There is not a willpower. There is not an anything. That is just medical science at work telling us that we can replace something for you that is going to help you maintain a healthy weight. And that was just mind-blowing to me that we have identified a hormone. We've identified GLP-1, and that signal really plays a role in helping to maintain weight and homeostasis, maintain that feeling of satiety that we are not hungry. And that is mind-blowing to me that we can do that with a medication. I think that it's really important for audience members, either ones who are on those medications for weight loss, but especially for audience members or people who watch from home that don't understand those medications, to understand this is not a quick fix. It is not a cheating method of weight loss. This is not something that should be taken lightly. This is a medication that should be discussed between a medical professional and a patient. And like you at home who maybe are not struggling with your weight or not on a weight loss medication, for you to realize that for patients who are successfully being treated with these medications, this is maybe for them replacing a hormone that they are deficient in, that is contributing in some way to a disease that they are struggling with. And by replacing that GLP-1 with a GLP-1 agonist, we are actually helping them maintain a healthy status. And for people who may feel judgmental about those medications, I hope this is a real education to you. I liken it to a diabetic being put on insulin. We would never judge that as a deficiency. We would never look at that as someone taking the easy way out if only they could will themselves to make more insulin and overcome their diabetes. That's just not something anyone would do in a reasonable way. So likewise, for our patients who are struggling with obesity, and we recognize that it's a medical disease, and we are giving them a medicine that's a tool to help them reach a functional state where they can maintain a healthy body weight, I think we should all be behind that. And as long as that is done under the care of a medical provider and those patients are being treated with the utmost care, respect, and proper dosing and treatment of those medications, that is something that we should all get behind. Lastly, I think that it's really important that we understand maybe and examine our own implicit biases and what we think about someone who may be having their struggle with the weight. That can be very personal, but it can also be widespread across their life. One of the things that really touched me, and it was a small moment in the show. There was one of the guests that Oprah spoke with earlier on in the show. Her name is Amy, and she talked about taking her daughter to the playground. And what she noticed after she had had a very significant weight loss was that other moms at the playground were nicer to her daughter after Amy had undergone a radical weight loss. And that just really, I don't know, that went to someplace deep in my mom gut where it just broke my heart that not only Amy, but that her daughter was affected by her mom's weight in terms of the treatment that she was getting from other moms at the playground. Check yourself on that. Have you ever judged someone, whatever the reason may be, whether it's related to weight or related to something else, and then gone on and treated their spouse, treated their children in a way because of an implicit bias or judgment that you had? That just really struck me in a way that made me say, we all just need to check ourselves and make sure that we are coming from a place and acting from a place of deep compassion for other people. You never know the journey that someone's been on, the journey that they have right now, and the place where they want to be going. And sometimes the place where they are headed might be a dark place. And the compassion that you can find in yourself might be the thing that changes the road and the direction that someone is going to help them get to a better destination. So Amy's story really is one that will stay with me from when I heard it as an audience member and as I go through my life, realizing that you have the capability and the possibility in your interactions with others to offer compassion, to offer grace, to offer hope, and to really keep your own judgments in check so that you are giving people a beautiful place to get to and a really safe space to be in with you. And I hope that that's something that you take from the Oprah show, and I hope that's something you take from this YouTube video today. So those are my takeaways from the Oprah show. I hope that you get a chance to watch it. It is groundbreaking and it is life-changing for some people. So if this video helps you understand some of those medications a little bit better, that's great. The Oprah show definitely will. It gets into much more detail. And I hope that you have an opportunity to really watch it and to be a part of the conversation moving forward. Again, I'm Dr. Lynn Nieman. I am so happy you listened to this video today. I hope it was helpful for you, and I hope you move through your day with compassion and grace. Thanks for tuning in.